Chris heads Hello for Good, a nonprofit representing over 100 businesses in the region concerned about the impact the homeless problem is having on commerce, especially in the downtown core. Chris Patterson, it's great to sit down with you.
Likewise.
Yeah, you're heading up and part of an organization, Hello for Good.
Yes.
But before we even get into that, I thought we could just kind of take a pause and go through your background. A lot
Sure.
of it here in Spokane.
Yeah, the majority of it.
Yeah. Maybe talk about that a little bit. I'm going way back, maybe.
Way back. I'll go way back. How about the birth?
Yeah, there we
I was
go.
born in St. Luke's. So, having not known my parents, my mother and my father, I was early on in the system. So put in back and forth and receiving homes, which is what they called them. I think they still call them the same thing. And then I was adopted at age 4 from the Pattersons, and hence the Chris Patterson name. My grandfather and my uncle, my grandfather was a city fireman. My uncle was one of the main sheriff's deputies who did a lot of the hiring for Spokane County Sheriff's Department.
Mm-hmm.
My adopted dad worked for Burlington Northern Railroad, which at that point in time was one of the main employers.
Yeah, a lot's changed.
So a lot has changed. Fast forward, not every family is designed to be a family, or I should say, not every parent is designed to be a parent, even as they're as best intentioned as they are.
Right.
But things turned out the way they did, and I went through the foster care system. Ended up going to Ridgeview, Farwell, Longfellow, Gary, Rogers, and Riverside. And then I graduated from Riverside from my foster parents out there. 7 schools. Yeah. So went through, once we graduated from high school, went into the Job Corps system up in Curlew, Washington, or Wakanda. And I ended up doing forestry, welding, brick masonry, and construction for other trades.
That's when you aged out of the foster system?
After I aged out of the foster care system.
At 18?
Yeah.
Wow. Real work.
It's fun.
Yeah.
And then I ended up fighting fires during that period of time when Yellowstone was on fire, so I got what they called a red card for the Forest Service. Ended up fighting fires and made a lot of money during that season.
Wow.
And paid for my first 2 years of school.
If you ever need something to do with, that's a much bigger industry now than it was then.
It definitely is.
Probably brings back memories every summer.
It does.
Fill with smoke.
What I miss and what I don't miss.
Yeah, no kidding. Not the kind of beginning I would think of to go on and do some of the things you've done. Maybe you could just talk a little bit about your role over at HUD.
Yeah.
And maybe how you came into that also.
For my role at HUD, it was a little different than probably most.
Chris, I should pause. That's the Housing and Urban Development federal agency, huge agency.
Huge.
Yeah, and so maybe talk about how you came into it. Maybe we can talk a little bit about the agency itself.
Yeah. When I originally had the opportunity to get in, there was 2 different periods of times. So the first time I ended up turning it down in a different position in the administration because it wasn't good timing. But the reason I had gotten there is I had sent in 67 letters of written recommendation from across the country from people that I know professionally that ended up being sent into the White House. So I had different positions that were given an opportunity to look at. Once I had some better timing fit, I went back to D.C. on my own dime, met with senators and other individuals, local tribes, chairmen of different tribes around the country, told them what I was doing, what my plans were. And
how did those plans come together for you? I mean, you had this keen interest in...
I believe in public service, so I believe that if you want the information, you need to get it out there and figure out where it's best suited to get the correct information, and make sure that you're doing your best to go through what's not BS and what is not BS, what is BS. And I believe in being blunt and direct and to the point, because that way I waste a lot less time on talking to people and they can figure out pretty quickly.
Right.
And I think I learned that through going through the foster care system and working in the field of social services for the last 25 years, doing my own stuff with my own companies, knowing that the reality of what is the real perspective of when I meet somebody who's at the worst possible time in their life, you literally have to go toe-to-toe with them to figure out what is best for them as an individual rather than a community. So when you develop a plan for that individual, you make sure that they have a successful launch into something that is beneficial for them, not me. And that's the same approach I took in when I got in the position working with Secretary Carson at HUD.
And what was the position you took?
Regional Administrator for Region 9, which is California, Arizona, Nevada, Hawaii, Guam, and the Pacific Islands. And there's over 547 employees, fantastic people, fantastic leadership team. All the administrators that we worked with throughout the country, there's 10 of us total. We're a fantastic team. Supported each other, worked with the staff, did everything we could to make sure and serve the people. Because I think people oftentimes forget that those administrations, every administration could change every 4 years. But the agencies are still there to serve the American people. Mm-hmm. And that's the mission for each of the agencies is what I appreciated, is the fact that they're mission focused.
Wow. So that's a pretty natural segue into the homelessness situation that we have here in Spokane now.
Wasn't what I planned.
So coming out of HUD then, Hello for Good, the organization that you head up now, maybe how did that come together?
Originally, I had just finished doing an assessment on the city of Spokane at the mayor's request to come in and evaluate the homeless department. And at the end of my time, it was August 31st, I let her know I would be done with my assessment. There was no purpose for me to stay on any longer. Now, once I had found my findings and I needed to, and I gave her the final report. And then I got a phone call from Washington Trust Bank. They're creating a brand new position that never existed before, and asked if I'd be interested in taking the lead on it. And it would be called a Community Solutions Advisor. And the focus would be to not just focus on homelessness, but mental health, addictions, vocational programs, everything that goes up into the situations where people end up, whether they're a paycheck away from losing their housing, whether they lost their car, different situations. So that way you can actually get the entire piece, which includes the education system, the mental health system, vocational system, social services, all the above.
A lot of moving parts.
Yeah, it's definitely not a simple situation.
Yeah, and it must have been gratifying to hear from Washington Trust. When we were in Houston, studying what they've done down there, and they've decreased homelessness over the last 10 years about 64%. You and I have talked about that. Mm-hmm. They got just about everybody involved, and it seems to be the key to their success. But one of the key ones is business. So Hello for Good was a call from Washington Trust Bank.
Yes.
Yeah,
and it was created with the intention of giving a pathway to make everybody thrive and be successful, to make sure that there's something that's out there for everybody that's not leaving any particular community behind. And the private sectors, when you match the public sector and private sector, things just work better. And most times you can have the private sector go way past the public sector because they are used to operating efficiencies, they're used to offering balance sheets, they're used to operating on levels that are more efficiency and outcome based, and they can show their metrics a lot faster. Mm-hmm. So you start looking at the systems, like what their approaches are and how things are done. I think that it's more of an approach that fits everybody's needs, not just one individual's. So the private sector has a lot more force behind it because they will put the dollars into something that they know will be their ROI.
Right.
To watch somebody go out of poverty into housing, into stability, get their kids back from CPS, conquer out, maybe alcoholism or drug addiction or other things, that's money well spent.
And then you just mentioned poverty into housing, or it might be chronic homelessness into housing, but that seemed to be a consistent theme. I think, this idea of moving people from the situation they're in into permanent housing, but also all those moving parts you were talking about, there's a whole lot of services involved along that path, isn't there?
Yeah. The complexities, it makes it challenging because some systems work, some don't. Yeah. There's gaps in between. Right now there's the issue of not just facing Spokane, but the country is hiring qualified skilled professionals, the shortage of those individuals who did the work, the psychiatrists, the RNPs, the nurses, the licensed professionals in the clinical world, the people who are boots on the ground, individuals that are going to be out there in the field working with these individuals, dealing with their addictions or their issues, their behaviors, or how they're actually going to fundamentally work with them.
Yeah. And Chris, with your experience, when we were in Houston, what we really saw and we heard over and over again, that there was really no way to talk about the homeless population in a general way. Every situation is different, and that's what I'm hearing from you likewise. And so it's not a one-size-fits-all, but we've been calling it, we'd heard about housing first, and we heard something different when we were in Houston, that it wasn't so much housing first, but an identification of all the services that were needed, which were different for everybody.
Yeah.
And then kind of matching up those services and then moving them once they were matched up with services. I mean, it might be just the basics. You need an ID card, you need a birth certificate.
Social Security card.
Social Security card, yeah. Likewise, the other needs that you have might involve psychiatric, mental health. It could be addiction counseling, or in some cases, it could be, it was somebody with fewer needs that, had a bad piece of luck that, they maybe were evicted and they couldn't get back into housing because of the eviction and that record. But the service needs were all over the map. But the one thing that seems like it's always needed is a path back towards, permanent housing.
Yeah, it could be multifamily, permanent supported housing.
Right.
There's temporary housing situations, but I think that you use the term housing.
Yes.
There's one thing that's always going to get in the way, and that's policy. It's either going to be effective policy or bad policy. And people may be well-intentioned, but when policy is created, what's the end result going to be? Is there already policies created underneath things that you have to get through to get to the new policy that's created? Or is there a redundancy of policies? Most times there's a redundancy of policies. In order for a city or a county or a state jurisdiction to grow, you've got to be able to weed through that without running through issues like SEPA or other laws that are taking place. And I think that all of that regarding housing, it's not just housing. Housing first, okay, great. But there are people who are not ready for housing.
Right.
They're addicted,
Yeah.
they're mentally ill. There's other issues where there's warrants. There's things that are inhibiting them from being ready for stability, and you can't possibly think putting them in housing right out of the gate is going to work.
Right.
Because then you're going to hurt the service providers, you're going to hurt the community, you're going to hurt just in general the larger, bigger aspect, which then puts a bitter taste in people's mouth.
So lining those services in advance, so that you have a concurrent service delivery and housing, and also, as you said, the housing varies. It sounded like in Houston, it could be anything ranging from a complex that was part of a low-income housing or other type of, public housing, but it was also oftentimes market rate housing, an apartment or something like that. I mean, It was really putting it together as best you can and then identifying it for the needed population.
Yeah, it's definitely a mixed bag approach. It's something that you have to look at I don't like to use the term holistic because I think it's used too much. I just say realistic.
Right.
What is realistic for that person that's facing that issue at their time? Do I know what issues their kids are facing? Do I know how many meals they're getting? Do I know if there's CPS issues? Do I know if there's adult protective services issues? Do I know if there's any criminal event that's there? Is there drug issues? There's things that we can't overlook, because if you miss one piece of it, it can blow the entire change of success for that individual or family. So you have to look at the whole piece.
When you talk about that, Chris, and I kind of want to get into maybe just policy in a moment, but when you talk about those various needs in the system, it sounds like you're almost drawing on your experience growing up in the foster system. Is that something that informs you as you go through this, or how does that kind of play into
Yeah, you learn through the school of hard knocks.
Yeah.
And I guess the realistic approach is I am a little different. I am extremely grateful and appreciative of the fact that taxpayers paid for my way to be in foster care. I think of things differently. And, I didn't bounce through a ton of foster homes. I had my share. I was definitely considered difficult or hard to place. I knew how to run. I knew how to take care of things. But I think the biggest thing is getting trust. And once you get the trust and you develop the trust and you get the respect with individuals, even small amounts, you start to gain the respect of the individuals. So it's, how do you use your life skills? How do you help other people? How do you get people to be mentors? How will they follow you? You don't go into it thinking that way. It just happens naturally. And I remember, as in my role under Secretary Carson at the U.S. Department of Housing, I was also the national lead for the Foster Youth Independence Initiative, which is a standalone housing voucher program just for foster youth aging out of the foster care system. So it's the same thing that you would hear. They want structure, they want to have their own identity, they want to have self-respect, they want to have dignity, and they want to know they're valued.
So your experience moving into the trades when you aged out, that seems to reflect some of those values you just stated.
I focus more on the vocational side because realistically I needed to be able to take care of myself. I needed a trade to learn because a 4-year college degree is not for everybody. And I think that you have to have that mixed bag approach, and I think we put too much emphasis on college and less emphasis on the ability to take care of ourselves.
Well, let me skip over to policy. Again, just drawing on the experience heading down to Houston, and really they're one of just maybe a couple cities in the country that have been able to show a graph with homelessness that's going down rapidly. We hear about a lot of really good policies in different cities, but Houston, maybe San Antonio are the only two I'm aware of larger cities that have an actual dramatic decrease in homelessness over the last 10 years. But it seemed like they found a way to use the leadership that's there. In their case, we interviewed their mayor down there, 3-term mayor, Anise Parker, and she was able to rally the entire community. And it gets back to the business community, like Hello for Good, and the business community. And it also got into the nonprofits, and it got into the different municipalities, the county governments. I think they had 4 counties. They brought everybody under one very large tent, and they actually were able to get, once they've got them all under that leadership was outside of City Hall. I think City Hall provided, the mayor provided the leadership for getting them into that forum. But at that point, you had everybody under the same tent.
Yeah.
And do you see value in that from your perspective and having worked for HUD and the different positions you've had?
Yeah, I think the biggest thing I learned is you got to take the politics and egos out of it. If you don't take those two things out of it, it's going to be really hard to get things done because there's always going to be somebody with an agenda.
Right.
And if you make it pure and clean, as it should be, and you treat it as an outcome-based objective, a mission, whatever you might say, then I think the reality of it is it becomes more of a bigger picture. You can build on it, and the success starts to happen. And you think about it. I mean, Houston, it's Texas. They believe in the social rule of law. They believe in outcomes. They believe in safety, security. They believe in protecting everybody's rights. They believe in taking care of the most vulnerable populations. But you have to have leadership clear from the governor down to the mayor and the city attorney and so on. They're going to support the same thing. And if they're willing to all support the same thing, regardless of political beliefs, because the mayor down there, she did a fantastic job by bringing the private sector in alongside, and they actually worked how to work with each other, and they set the same goals.
It seemed like they almost took the politics out of it, and when I step back and think about the many issues we deal with, local politics really doesn't feel like it should be political. I mean, when you're talking about roads and public safety and parks and libraries, the various services that are offered, they don't really feel like great ground for partisanship. But maybe at the top of that list is homelessness.
Yeah.
And you're going to have a symposium here coming up, but it seems like if you have hundreds of people at a symposium talking about homelessness, and they're probably there for a lot of different reasons. I mean, some people might be there because they have a small business that's being affected by homelessness downtown. Mm-hmm. Other people may come to it because they're just feeling great empathy for the people that are in this plight, and everything in between. But it seems like there's room under that umbrella. I mean, if they're there and wanting to contribute, there's room for every single perspective and every single person to contribute to the solution, because I don't think anybody disagrees that everybody in this community coming together to resolve and work on and resolve homelessness. I have yet to hear somebody that doesn't agree with that on some level, and I think every perspective is welcome in trying to achieve that. Does that resonate for you, Chris?
Yeah. The biggest thing is the communities at large all want the same thing. They just go about it differently. You can use social media to try to raise your awareness of the issues, which sometimes works in certain ways, but the best way to do it as a community is bringing the private sector, the public sector, law enforcement, fire, EMS, the hospital systems, the mental health systems. Every aspect of a community has to be there at some point in time. May not be at the same table all at once, because that's a big tent and a lot of personalities all wanting to push their agenda. So you bring them in strategically and how they're going to come in, when they're going to come in, and try to get the same answer. And then after you get that answer, you find out they're all on the same page and they weren't in the same room.
And then you can start to coordinate activities and the work that's being done to resolve this. And it seems like that's the central element in all this. That, one of the other ones, and I think maybe when people look at the homelessness situation, it looks like a very expensive, problem to try to fix. And in my 18 years as the chief financial officer for the city of Spokane, I always found that it was seldom a resource issue, but there was a big agreement issue. Getting everybody to come, the willpower, getting people to come together and, kind of let down their agendas and find a way to work together to get it done. And when we've been looking at it now, it sounds like, the numbers range, but the cost of leaving people homeless on the street when they're using all those different things you just listed off, the EMS, using the hospital as a regular provider of medical care, the criminal justice system, all those things that when you add them all up, it's way, way more expensive than just dealing with it. And I think Houston had some numbers that were somewhere in the range of about $17,500 to put people into housing with the services they need to succeed, as you were discussing earlier, versus upwards of 80, 90, 100,000 for leaving them on the streets. So the proposition was almost, can we afford to fix this? And it was more like, can we afford not to?
The biggest thing is people have to understand there's three populations. There's the have-nots, can-nots, and will-nots. So the will-nots are the people we would call shelter resistant, refuse to do anything, don't want to follow the rules, don't want to go in, they want to do it their own thing. So there's 2/3 of the population you could support. Some of those people want the services and don't know how to get it, and the other population needs the services and they want to go get it. It's just they're in a bad situation.
Right.
So it's not like you're giving them free stuff. You're going to give them a hand up to get out of the situation because a lot of the population wants it. They just need their help in structuring how to get it and keep them on the same path.
Right.
So you can't just again, it goes back to put them into housing is fantastic, but what next? Because it's not going to solve the issue unless there's some sort of treatment modalities that are going to go along with it, wraparound services, through the coordinated entry. The COC boards across the country have to really think about what they're going to do different. And maybe there's a place for them at the table in certain areas, and maybe they need to back off and let the providers do the work. And they've
got to get under that tent so those kinds of decisions can be made. I think Houston's, they had somewhere in the 90% range, I think it was 92% of people that had gone into housing were still there a year, 2 years later, but it was because, as you're saying, they received the services and the support to succeed. They weren't just pushing them into housing without that support that they needed.
And they're building, and they have built navigation centers. So they cleaned all their tent encampments. Well, they're not as many. I think they have a few. But
well, Chris, on that front, at some point I asked Mayor Parker, because we wanted to observe, because we're comparing Houston to Spokane, it's a normal thing to go out and say, how are others doing it? But we wanted to see what the encampments look like there, and we really weren't able to find them. And her comment was, well, that is the right-of-way, and it's a public right-of-way, and nobody has the right to block the right-of-way. But what they did do was grandfather all the existing encampments at the onset back in 2012, and their timeline is well ahead of ours.
Right.
But from that point forward, there were no new encampments, and they're decommissioning them one by one with these, wraparound services and identification of housing, one by one. But then once they're gone. And in the meantime, when people are offered these services and offered this support to succeed, if they do say no to it, and it's that small portion of the population that does say no, at that point that's not tolerated. So you just walking through downtown Houston, you're not seeing the kind of homelessness activity, but again, they're ahead of us on the timeline. They managed to come together and really make a lot of headway on it.
And they had leadership that were willing to be bold, and no matter the cost of the thought of being reelected or not, she made the choice to do what she thought was right and said it's not going to be tolerable.
Right.
And that's not left or right, that's just humane. We're not going to tolerate that kind of behavior. We're not going to tolerate this kind of things that are in our community.
And it's not healthy.
It's not healthy
for anybody to be living on the streets.
And the situations we're seeing here and across the country, Spokane is no different from any other city. The difference is here in Spokane, we live here, we reside here, this is home, and we care about it. So we want to see it become a model for the country, like Houston has done for their own city. We want to do what's best for the city of Spokane and the region, and you need all people to work with each other. Otherwise, it's gonna get worse. And right now, we see that happening. It's the constant clashing, and it's like, let's just focus on the bigger picture because it's not about you.
You are organizing the business community, and that's really important. So tell us a little bit about what's happening there.
Well, when we first started, it was I think everybody was so frustrated that they didn't really know where to go. and
Yeah.
which is normal. And then as we started reaching out to people and I was starting to get out in front of people and presenting to organizations, whether it's GSI or Gonzaga University or BOMA, a lot of the businesses started to say, okay, hey, we want to be a part of that. So I think they
So
were
you're
waiting.
seeing a lot of interest.
There's a tremendous interest. The universities, that's the focus, to bring in the universities across the region. We have several here. So you think about the academia part with the research and statistics and the studies that they could provide, and the mental health schools they have. There's kind of a pathway to partnership where they can help the other organizations and also create jobs. So by doing the on-the-job training for situations of these fields, they can actually expand what they want to do, and everybody benefits. But we're having, I would say, a large number of businesses coming to the table now.
About how many businesses, if you had to guess right now, have shown an interest in supporting?
Over 100.
Wow, here in Spokane.
Yeah.
So even universities, obviously healthcare providers, but even mainstream businesses like banks that you're representing.
Well, and considering that what's happening is, this is Washington Trust Bank is one of the few banks in the country that I'm aware of that has decided to do this as a community initiative and just tackle the issue because it needs to be done.
And that's what we saw in Houston. I mean, the mayor there was able to get the owner of the Houston Astros and the Texans and the endowment, the heads of the endowments, and everybody into one room, the bank, the CEOs and others into the room to help support in their respective ways the broader initiative that everybody agreed on, needed help.
Similar to San Diego and the Lucky Duck Foundation and how it happened with their private dollars and what they're doing. So it's the same thing. It's across the country. People are recognizing. I had a group from Wisconsin recently reach out and talk about what we're doing, so they've already heard about it. So they know that the private industry is going to have to be the stewards of looking at the costs, looking at the outcomes, looking at the involvement, looking at the benefits to having more people involved from the private sector, whether you're small, medium, or large businesses, for-profit or non-profit, it makes no difference. Because in other words, there's too much to lose and everything to gain.
But obviously you're there not to co-opt the initiative, the homeless initiative, but to support the work of the health providers, even the people on the front lines, the shelters and the others that we see. It's part of building an entire system to achieve these outcomes that we've been talking about.
We want to see people succeed. I think the one question I had to ask today is that, how did you get out of foster care? And I said, well, I've been out of foster care a long time. And they said, well, no, how did you succeed? I want to know how you succeeded because I want to copy it. Can you help me? And this is a younger person. So, she was pretty clear in the fact of what she wanted. And I said, well, I learned the hard way that I needed to surround myself with people I know, I like, and I trust. Because they're not going to tell me what I want to hear, going to tell me what I need to hear. So that's the same thing we're facing right now. Sometimes the cold hard truth is the cold hard truth. If we're not doing our jobs, if we're not being the adults, then I think it's time people need to realize they're getting their ass kicked and they need to do something different.
So, Chris, likewise, with over 100 businesses expressing interest, what are you hearing from them? What do they want to see you address?
For those businesses that are probably a little nervous because they feel like they're being called out, and usually they're concerned about if they say something, somebody's going to come after them. So they'll come to us privately and they'll say, hey, we're concerned about the safety. Number one issue we see with the employers is the safety of employees. They don't want to come downtown. They don't want to work downtown because they don't feel safe. The cars are getting broken into. There's feces in front of the doorsteps. There's syringes. There's other things that are out there. So we have to try to beat that stereotype. It's not a stereotype. It's what they see. So how do we make sure that the people feel safe? And the biggest issue is how do we make sure that it's partnered with them giving a voice? So does the businesses have a voice? So we want them to come participate because it can't just be us speaking. We'll speak with them or on behalf of them at first, but we want them to come alongside. And as they start to come alongside, we will put more logos on our website for the businesses that are endorsing Hello for Good. They want to be part of that. They want to have it on there. But the biggest thing is involvement, trying to get them to be courageous, to send letters to the city council, members of Congress, their county commissioners, whoever it might be, to step up and realize you have an option to do something or you have an option to do nothing. And if you do the nothing part, it's a lot more expensive.
As we were talking about, a lot more expensive, and it's certainly not helping the homeless.
No.
I mean, doing nothing is just that, and we've seen the curve of doing nothing. Certainly down in Houston, we heard one success story after another and spoke to a lot of homeless individuals where, that success was reflected in their own lives. And so it's the classic
It is.
win-win. So, Chris, you're obviously talking to businesses, but you're also talking to the homeless themselves, hands-on. And what are you hearing there?
Different stories. Not everybody has the same path, nor do they have the same desire. So most of them want to be treated with respect. I mean, I can go through different treatment addiction facilities, and I can meet different people who are on the streets walking downtown. I'm not shy, so I'll just walk up and talk to them, and they're not shy either. Maybe I'll buy them a cup of coffee or something if that's what they want. We sit there and chat, and just make it real. And then they'll tell me what issues they've had, where they're at, why they're here. I've met people who've been homeless for 20 years. I've met people who've been homeless for 6 months. I've met runaways, you name it. Individuals who've had to sell or trick or trade to survive on the streets, which is again not humane. But I think the biggest thing is what their outcome is they just want to be treated with respect for the most part. I would say for the entire part. Yeah. We all do. But they want to have a place in life as well, so when they look in the mirror, they have that self-respect. They see what they've done and the lives maybe they've ruined, either through addiction or other issues, and what they've done to their bodies. And they're aware of it. They live with the guilt just like anybody else.
Right.
So I think the biggest thing is how to figure out where do you go from there. How do you build people up and how do you educate the public to make them think, look, we're not here to save the world. Let's be realistic. This isn't puppies and rainbows. We're dealing with human lives. Some are going to be resistant, some are not.
Right.
So we'll have to figure out who is ready and who's not.
So compassion and empathy, a lot of that, but at the same time, a sense of urgency around wanting to get some solutions in place.
Exactly.
And to that end, you're sponsoring a symposium coming up, and maybe just talk about that. You mentioned the Lucky Duck Foundation in San Diego and what you're trying to accomplish with that.
San Diego's metrics and information has been used by different folks. Former Governor Christine Gregoire, they created an organization called Challenge Seattle. Some of the top executives in the country, all for the same purpose of bringing business together to help change the status quo of a city, maybe help the city get out of their way. Maybe they need help, maybe they need a little force. And the biggest thing that I've seen is where there's limitations and where there's not. And I think that's where you have to really decide what San Diego did with former Mayor Kevin Faulconer, and then you have Rick Gentry, the former San Diego Housing Authority president, and then Drew Mosier from the Lucky Duck Foundation. All three of those were kind of married at the hip. And sometimes the private sector would gently, with a stick or a carrot, come by and tell the elected, this is what we think you're doing, or you're wrong. Or they would talk to the housing authority to find out where the gaps are at, what's going on, where they can work with different services. And that's why they did such a successful program during that period of time. I believe it was about down to 18 to 24% reduced in homelessness. I don't remember the specifics of the exact.
Probably the best number in California.
It was one of the best numbers, and now their numbers have gone backwards.
Right.
So it does, if you were to track it, it does come down to policy.
Yeah.
And how do you make effective, safe communities for everybody?
So in terms of that policy, Chris, and just kind of circling back, we heard some State of the City address yesterday from our mayor, and so obviously a lot of attention there, a lot of concern. At the same time, in both of those cities, what we saw was that strong leadership from the strong mayor, for instance, in Houston, the same form of government, where you have a CEO running the city. That's that strong mayor form of government that we've had since 2003. And so you got that leadership, but at the same time, they placed the operation, the umbrella that brought everybody together and started to coordinate the many activities, all the detail. And it's huge. You listed so many of the moving parts. They placed that outside the city organization. They felt like the politics, and for a variety of reasons, that the city was not the place to have a key person helping to be, use that leadership role of the strong mayor to leverage the community into one place. but then the actual workings were in something in their case called the Coalition for Homelessness, and that had all the data metrics. They had more than a dozen people doing the so-called HMIS data inputs and all those things. At any given point in time, they know exactly who is where, their background, their needs. Data was a huge part of it, but they also had all these workings of identifying the services that were needed, the housing. There were all these moving parts. That was all back over here with the coalition, and I think maybe that's the greatest possibly leadership that a mayor in any city can provide, is really using their position to bring everybody together and get them marching in the same direction. And I don't know if that's with your experience at HUD and other places, how do you feel about that?
I would say that's correct. I mean, I think that the mayors, there was a national report from the National Mayors Association, if I recall, early on last year or this year, where mayors are not homeless experts. Elected, I should say, are not homeless experts.
Right.
And to bring something from the outside to actually help things run and facilitate is a better approach than making internal, because if you bring it internal, you got too many opposing forces, you've got too many departments, too many agendas or things that could be in there.
Just in Spokane, nearly 50 departments.
Yeah, so then you bring in other contract pieces, and the data systems are key, contracts for providers are key, systems have to be updated, they can't be antiquated, they have to be up with the current times. And you have to realize, how do you build a robust provider system, and how do you entice providers to come to an area that's not from here? And that's going to be key as you build, because as the city grows, so will the demands. It doesn't mean we're looking to grow homelessness, but we're trying to focus on how do we manage what we have now and make it better, so we do a better job of controlling it.
And a lot of it was there were redundant services. You'd have a need for beds over here, but those people perhaps are only providing beds for veterans. And over here you had a need for beds, so you have open beds over here, but nothing over here. And so by putting everything under the same umbrella, of course, you got rid of redundancy. You got the different parts of the city, or the various organizations providing services were no longer competing; they were collaborating.
Right.
And back to what you said about efficiency and effectiveness and outcomes. We need those outcomes, and I think we need to have a real sense of urgency, because obviously, as you said earlier, doing nothing, the graph isn't going in the right direction.
No, it's costing us more, not less.
It's costing.
And it's going to be more expensive to get control of it. It's no different than if you try to treat cancer.
Right.
It's the same thing. Are we going to treat the symptom first, and then we're going to try to find a cure? The answer is yes, but we want to be able to get to that point. You can't get the cure right now.
Right.
You got to treat the symptoms to make sure things are stabilized, so you can get to the cure.
Right.
And that's where it's at.
And when we use, there's so people come at it so differently, and they end up going like this. If one person is coming at homelessness from a strictly compassion and empathy perspective, and then another person who might be extremely compassionate and have a lot of empathy, but their main concern right now is their business is suffering because the downtown business environment has been affected by homelessness. They may be coming at it from a strictly dollars and cents perspective. And I don't see any conflict there.
No.
If you're there to be efficient and effective, it's going to improve the lives of the homeless because you're providing the services and ultimately the housing that is needed for them to move forward in their lives. And if you come at it from compassion and empathy, likewise, you're moving in that direction also through the various mechanisms they're using. Yeah. It's all working towards the same end.
And businesses are key, because in order to have a city, you need to have a thriving economic engine, which is the small, medium, and large businesses, and a strong health sciences division. In order to have that, if you have a strong economic engine, you have philanthropy. If you have philanthropy, you have donations, which means it helps feed to strengthen those agencies. If you don't have that, we don't have a strong support system.
We've got a really great healthcare as a city.
Right.
I think we have a larger portion of our economy is driven by healthcare than almost any major city in America. We're in the top 100 MSAs in America, and I don't think there's another MSA in America that has as high a percent of the economy based in healthcare. So really, if there's any city that can do a great job with this,
it's going to be Spokane.
It's going to be Spokane. We're sitting in a park right now that's one of the great representations of everybody coming together for Expo 74, coming up on the 50-year anniversary for it. And it's this extraordinary gathering place for a whole community. It feeds the entire community.
And history is going to repeat itself.
Okay. We can do better than that for an ending. Thank you, Chris.
You bet.